name is AminaIbrahim. I work in Likoni Sub County. In Mombasa County, I coordinate reproductive health. So on behalf of Likoni Sub County, I will represent this project we did as a QI project in order to reduce maternal and perinatal deaths. So our title was Reducing Maternal and Perinatal Deaths Through Effective Referrals, especially of the maternity cases in Likoni Sub County. So it is estimated that 61% of neonatal conditions and 50% of maternal mortalities are due to poor, especially in the middle income countries, due to poor quality services. So in Likoni Sub County, we had experienced 11 maternal deaths between the period of April 2021 and March 2022. 7 of these deaths were from the facility and 4 were from the community. So we all know that we do maternal audits, the MPDSR, especially the maternal and the perinatal. So during the audit, we found that 45% of the deaths were due to non-adherence to referral guidelines. So as a sub-county, we felt that this was a big issue. We need to tackle this as a priority. So we decided to take up this to reduce maternal and perinatal deaths and through the effective referral in all the facilities offering maternity services in Likoni. So what we did, we picked 10 facilities offering maternity services in Likoni, and we engaged them in a discussion in order to get the contributing factors for the non-adherence to referral guidelines. And we also customized a checklist from the national guideline of 2014 so that we could get a baseline from this facility and then compare after the interventions. We did descriptive analysis through Pareto charts. The results were reported as frequencies and percentages. So some of the countermeasures of what we did, we customized. We adapted the 2014 guideline and customized a referral form. Then we also developed, we customized the guidelines. We customized SOPs and distributed to the facilities, because most of the facility didn't have the referral forms. They didn't have, we documented, the documents were printed and disseminated in the facilities. We also identified referral coordinators, because we, as my first presenter said, that we need to network. So we came up with also a referral directory, whereby we got numbers from the facilities after identifying the referral coordinators, printed them and distributed them to the facilities. And then we monitored the indicators on a weekly basis. So after the intervention, we found that the frequency of the contributing factors reduced from 40 to 6, with a reduction of 34 and a percentage of 85. And the maternal mortalities reduced from 7 to 1, that is at the facility level, and 2 at the community level. So in total there were 3, with a reduction of perinatal death 50%, 21 to 19, a reduction of 10%. The 50% was from the community deaths. So that was the frequency before and after, whereby it showed the incomplete, some of the contributing factors, incomplete documentation of the referral forms, lack of referral coordinators, no designated receiving area for maternity cases, emergencies. Communication was not done. We know communication is key in referral. So many patients were just being taken to a referral and receiving facility, the level 4, without communication. So you can imagine a case of mothers who are delivered in a level 2 facility and is being transferred to a level 4 facility without communication, cases of PPH, cases of APH. So it was a very bad situation. We used to get the county team all the way from the offices to Likoni Sub County just to encourage us to handle these issues. So in conclusion, we found that effective and the referrals using the national guidelines can influence the reduction of maternal and perinatal deaths. We recommended that all facilities to adhere to the national guidelines so that we can be able to reduce maternal mortalities, and we can get to the 2030, whereby we'll have at least 70 maternal deaths per 100,000. So the Department of Health rolled out the activities to strengthen referral across the county. So we are happy also here to report that this recommendation has been taken up by the county. They have formed a referral strategy committee and trained referral coordinators from all the facilities in Mombasa County. And right now we are customizing the referral forms for Mombasa County and coming up with referral service directories. So lesson learned in this: adherence to national referral guidelines can significantly reduce the maternal mortalities and perinatals, and also immediate reporting of the poor referral cases. So we had developed a habit of reporting these cases. Whenever a case has been transferred without being accompanied, without following the national guidelines, they will report. So the facility receiving the patient will report to me, then I will follow it up with the referring facility. We call them, we review the case, we come up with action plan so that we can be able to reduce the maternal cases. So what were the best practices? The auditing, especially of the near misses. The referring facilities are engaged, as I stated earlier, and then identifying the referral coordinators, that is for networking. And also in the directory, we had put the phone for the 2 ambulances. We have 2 ambulances in Likoni Sub County. That is one at the level 4 Likoni Sub County Hospital, and one is at Mrima Maternity Hospital. So we made use of these ambulances, coordinating the referrals from the facilities as low as the level 2, and including the private facilities, because this project we included both private and the government facilities. So the ambulances were needed even at the private facility. We can coordinate and take the patient to the receiving facility, and even as far as the referral, that is the Coast General Referring Hospital. So we also customized guidelines, the SOPs for maternity referrals. They were also available. So at this juncture, I want to acknowledge the county government of Mombasa, the Department of Health, and then the QI unit, the RH program in Mombasa County, the Likoni Sub County Health Management Team, and also the health facilities in Likoni Sub County. Thank you.